I want to go around, Amanda, you're not in a medicine per se, and and Alyssa, you have been in medicine, but when everybody calls the procedure minimal invasive, what do you understand when people say minimal invasive? What does it come to your mind?
Small incisions.
Small incision?
That's a good point. Yeah. I will establish that the general population also could be convinced that minimally invasive is anything that you tell them.
Yeah.
Literally,
Yeah.
I get that very often. I mean, for me, minimally invasive comes down to, what is invasive?
Yeah.
Invasive is, like you said, big incisions, lots of
Yeah.
blood work, long time in the
Muscle.
OR, under anesthesia. So for me, minimally invasive is limiting that down to the minimal, the
Mhm.
smallest amount that it could be possible.
Yeah.
Mhm.
No, educate us, first of all, I know everybody calls his procedure minimal
Mhm.
invasive,
Literally.
everybody.
Yeah.
Even people who open up your belly this big and put all the organ to the side, go
Yeah.
to the ALIF and so on, and they call it
Yes.
minimal invasive. But is there a unified definition of minimal invasive?
I would make it completely easy. So less intervention in comparison with conventional procedures. If I just want to summarize that,
Mhm.
I would do that like this. And for sure, in different societies, in public, in non-medical talks, you hear with lots of names. For example, the doctor operated me with laser.
Mhm.
Yeah. For example, for laparoscopic surgeries, I did laser surgery. In laparoscopy. We don't use a laser or something like that, but it's famous with that,
Yeah. Where did the word laser in the surgery came
I
from?
don't know.
No, but I know it's
Yeah.
It sounds futuristic.
It sounds
Ninja
futuristic.
marketing.
Yeah, it is
Yeah,
actually
yeah.
ninja marketing. Now, let me tell you that when I started my residency in Germany in 1996, that's a long time ago.
Yeah, I can now calculate your
Yeah,
age.
you're safe.
Yeah,
Yeah.
we
Barely.
had at that time a laser machine that was collecting dust for 7 years in the closet.
Oh,
And because in 1980s and so on, we thought, right now we're, let's say, part of the disc come and push on the nerve.
yeah.
We go pick it up with the forceps, we put a pill, take it, pull it out.
Okay.
Okay, that's what we do. In 1980s and so on, said, isn't it a great idea, instead of going with the forceps, taking it, pulling out, we vaporize it and we suck it out like a smoke, we burn it out. And something that you could go and take it and pull it out in 2 seconds, you were there 15 minutes, vaporizing it and sucking it out. And then people 6 years, 7 years before I noticed, stopped using that, was collecting dust in the closet. So it was a good idea, but when they increased the volume or the energy of the laser to vaporize more, so they don't have to go half an hour for that, for something that they could do with the forceps in 3 seconds, then you make the laser would penetrate and cause more damage. And that was 1996. That's a long time ago now, but the name stuck, and the laser spine, and even it was a company that went out of business because for every month their operation, they had a lawsuit. They promised things that they couldn't deliver. And I talked to one of those doctors. They would just talk about the laser, and they would bring the laser machine, turn it on and off, but then do regular surgery because even they knew it's really not working. So that is where the word laser is coming from. Now, in some other surgeries, like eye surgeries and so on, laser has a huge value.
Yeah, for sure.
But I don't believe anybody, not only we have proven, not only we don't have evidence that laser in the spine doesn't work, but we have evidence that it adds to the complexity, complication, and the time of the surgery in the spine. So we have evidence that's really not a good thing for the spine. Or no, I haven't heard of any reasonable surgery in the last 20 years using actual laser in the spine. Have you?
No.
Okay. So that's something we know. But coming back from that, you remember you said something about the minimal invasive being a smaller incision?
Yeah.
I think what's matter even more than the skin incision is what happened under the skin. For lack of other term, in a regular surgery, we don't figuratively, we literally fillet you open.
Mhm.
In a regular like PLIF or TLIF, we go in, we separate all the muscles from the bone. So I was very actually excited being with your Professor Demel in Germany, that he did the mini Wilsti. He didn't separate the muscle,
Yeah.
and that is why he has good results.
Yeah,
because-
for most of our patients, we don't do that. So we go intramuscular.
yeah,
So we go, we say that dorsolateral.
dorsolateral, yeah.
Yeah,
Wilsti
yeah,
approach.
we'll
that's
see
called.
approach. Yeah, and then you're gonna have very little of bleeding. So
Yeah.
you experience that in
Yeah.
our center.
Now, why is it separating the muscle from the bone a bad thing, Alyssa?
Because then it's causing scar tissue. which-
Well, muscle turns into scar. And as well, the vascularization of the bone is through the muscle. And then you prevent that as well. You got it.
Yeah.
So,
You got it.
You got it.